Hi everyone. Whenever you are planning to intubate any patient, first make it sure that you have a plan B in your mind. You should know whom to call for help if anything goes wrong. So you should must have plan B in your mind. You should have someone to call for help, some senior person with the airway experience. Another thing, you should have supraglottic airway devices like LMA, combi tube. You should must have boozy, uh, stellate, suctions and everything in its place. You should have front of the neck access kit, and most important thing, you should be very good in ventilating a patient. Intubation is not that much important as much as ventilation. So because if you are not able to intubate the patient, if you are able to ventilate the patient till the patient, someone else, some other senior person comes and take care of airway, control the airway, till that time you should know to properly ventilate the patient. If you are in a position when you are not able to intubate and you are able to ventilate, you can manage the patient, and patient will not be hypoxic and there will not be any hypoxic brain damage or further any complication. But if you are in a situation where you are not able to intubate and you are not able to ventilate, that is airway failure. So that you should not let it happen. For that, you should be very good in ventilating the patient. So preparation is very important, and you should have in your mind that okay, so how to ventilate the patient. You should know to ventilate the patient. You should know the C and E way of holding the tube by single hand or with two hand with another one, doing ambu. You should have oral airway, nasal airway as an adjuvant, which can help in proper ventilating the patient. Proper positioning and these things are very important. Don't paralyze the patient, don't sedate the patient if you are not good in airway management. And although ventilation, this sedation and this paralytic helps in making the relaxes the muscles, and it become easy to intubate. But if you give paralytic, which suppose you are giving paralytic like atracurium, vacuronium, it will require 30 minutes, may require 30 minutes to recover, even more time to recover. In that case, for 30 minutes you may not be able to ventilate the patient, and if you are not able to intubate, then that it could be dangerous. So don't do that. Thank you.